So we're going to watch a video now on my PresbyLASIK procedure, and I thought it would be a nice way to educate on what one can expect during such a procedure. So here you can see I'm sitting in the waiting room and they're giving me drops, and one of those drops definitely is local anesthetic, and then there's also an anti-inflammatory that's going to help with the pain relief after the procedure. And then here I'm in the laser room, lying on the bed, and they are preparing me. And then there's a drug placed. Next thing is they're going to perform the flap, but first I need to open my eyes or keep my eyelids open. And this is a question that I often get from patients: is they are scared that they won't be able to keep their eyes open. So here you guys don't need to worry, because we actually have a small little device that's going to comfortably keep the eyes open for us, and so that you don't need to actually keep your eyes open the whole time. Then we're going to dock the laser, and this is the femtosecond laser, and this is the laser that we're going to use to create the flap. So then the flap gets created with those little blue lines in a sweeping fashion, and it's quite quick. It's a few seconds. Now the next step is where we're going to lift the flap, and you can see the laser arm moving with the microscope. And here Dr. Sun is now bisecting my flap loose, and she's going to lift it soon. And then once the flap is lifted, the stromal bed is exposed, and the laser gets performed. It's actually very, very fast. The physical laser part is a few seconds, 4 or 5 seconds, and we are done. Then she puts the flap back and irrigates under the flap to make sure all the debris is out, and then the squeegee. So patients always tell me that they can remember the squeegee part. We just use a sponge to actually, with a sweeping motion, put the flap back in its place. So another question that I sometimes get is, how does the flap remain where it's supposed to remain? So there's actually cells in the cornea that has a pumping mechanism, and they keep the cornea clear by pumping the fluid out of the cornea into the aqueous fluid of the eye. And it's this pumping mechanism that's actually sucking the flap tightly towards the stromal bed. And so that's how the flap remains in position in the initial period. Before we leave, Dr. Sun just look at my flaps to make sure that they're all in position, there's no wrinkles. Then we get some drops in the eye and put our shields on, and then we are ready to go home. Afterwards, about 2 hours of discomfort. It wasn't that bad. It just felt a little bit scratchy. But as I said, if you go to sleep, then when you wake up, your eyes will be comfortable and you'll have actually very clear vision already.